bring an update today on the progress related to the 24 to 27 strategic plan for the health unit. And so today, we're going to do a recap of priorities and strategies, the implementation progress, and then highlight a couple of strategies. So we're going to provide a brief recap of what the priorities and strategies are under the strategic plan. We're going to go over the implementation progress in the past year, and then we're going to have a strategy spotlight presentation on two of the strategies that Tanya and Shannon will both be presenting. And so this will be two of the 11 overall strategies we'll speak to. And our goal is going to be to attend board meetings twice a year and give updates related to different strategies and highlight the work that's being done related to the strategic plan. And so today is also going to have an overall update of the strat plan just for a refresher for people. And so our strat plan begins with looking at the vision, mission, and values, which anchor a strat plan for an organization. It identifies what we strive for in this organization, which is our vision, a healthy community for all, how we will go about achieving our vision, which is our mission to foster healthy communities through partnership, preparedness, prevention, promotion, and protection. And then we'll also look at the values that every member of our organization holds that guides our daily work. So our values, as a reminder, accountability, we serve responsibly with honesty and transparency. Adaptability, we respond flexibly to emerging trends and circumstances. Collaboration, we increase capacity and connection through partnership. Equity, we act justly and fairly, respecting unique needs. And empathy, we are compassionate and understanding. So I'll go over just quickly the three priority areas of our strat plan. And priority one is a focus on organizational well-being with a goal of enhancing engagement, learning, wellness, and development in our culture. Under this priority area, there are four strategies. The first being establish pathways alongside employees for their growth and development. Next, foster leadership through improved performance management and succession planning. Third, which we'll be hearing about today from Shannon, nurturing a psychologically healthy and safe workplace. And finally, strengthen communication, understanding, and cohesion within teams and programs. Our second priority is a focus on health equity, and with a goal of catalyzing community attention and allocation of health unit resources to addressing social determinants of health. And there's four strategies under this priority area as well. The first being strengthening organizational and public understanding of discrimination, racism, and racial equities public health issues. The second is fostering Minimum Waterland, which is the good life with Indigenous partners, communities, and individuals. Next is advancing initiatives to address mental health, substance use prevention, and harm reduction, and Tanya will be highlighting that strategy today. And finally, cultivating our role within system-level efforts to reduce poverty and homelessness. And finally, our third priority is communication, connection, and collaboration. The goal is to bolster external relationships to enhance public health outcomes. And there's three strategies in this area, which include grounding actions and relationships in our vision, mission, and values, raising awareness about the needs addressed by the health unit, and finally, developing relationships with community partners to collectively advance shared goals. And next, Danielle is going to speak a little bit over the implementation of our strat plan over the last year.
Great. So we released our strategic plan 1 year ago, almost to the day actually. And implementation of the plan has proved to be just as big of an endeavor as developing the plan itself. So throughout the summer last year, team discussions took place where programs and services were tasked with discussing and digesting the plan and doing a scan of their program activities to determine alignment with the strategic priorities and strategies. Moving into the fall last year, an implementation framework was developed and work groups were formed for all 11 strategies. The framework outlined the roles and responsibilities of those accountable for mobilizing the plan. So 2 priority leads oversee each priority area, 1 to 2 strategy leads oversee each strategy, and each strategy has 4 to 6 work group members from across the organization. The Foundation Services team supported this phase by holding a planning session with all strategy leads to ensure consistency in how the strategies were rolled out. As we entered 2025, work groups started meeting regularly to work through the planning pathway, which culminates in a work plan for their strategy. The pathway, as outlined at the bottom of the slide, is divided into 4 stages: assess, recommend, plan, and implement, and and monitor. Throughout the past 6 months, strategy work groups have been working through the first 3 stages with the support of their priority leads and foundational services. This work entailed defining the scope of each strategy, reviewing existing data to inform the focus areas of each strategy, or creating a plan to collect new data if required, and then using this information to develop outcomes, indicators, and activities, and putting this information into an evergreen work plan that includes timelines, responsibilities, and evaluation measures. Accountability checkpoints were also built into the process to ensure groups were progressing through the stages and allowing opportunities for questions and feedback. We are now moving into the implement, monitor, and evaluate phase as we enter the last year of 2025 and beyond, where work groups are finalizing their work plans and always keeping them up to date as work progresses and evaluation of activities take place. The first quarterly reporting deadline is July, and then quarterly thereafter for the remainder of the strategic plan cycle, and future Board of Health updates will take place twice per year, as Chris mentioned, spring and fall. Lastly, evaluation touchpoints have been planned throughout the strategic plan cycle to reflect on the effectiveness of the implementation of the plan itself and make improvements where needed along the way. So we're going to move into our first strategy spotlight, and I'm going to hand it over to Shannon online.
Thank you, Danielle. So as mentioned, the strategy that I am leading is to nurture a psychologically healthy and safe workplace. So as Danielle highlighted, all of the work groups are moving through those 4 planning pathway stages. And this work group completed the assess stage earlier in 2025, where we defined key concepts that are going to serve as the foundation for this strategy. We also did data collection, but more focused on data review of existing data and also doing some analysis of that data. We also reviewed a logic model that was already in place by the internal mental health working group, and that's a work group that was established prior to this strategy, and that work group was responsible for starting the foundations that we're now building off of. We are now strongly in the recommend stage. We're just wrapping that stage up. We're determining our outcomes, and we're revising and updating that existing logic model. So let's start with some of the key concepts, just so everyone in the room is on the same page about where we're going to take this strategy and what's really shaping it. So psychological safety. That's an employee's shared beliefs that they can take interpersonal risks, such as sharing ideas, asking questions, and speaking up, all without fear of reprisal. Psychological health is a state of well-being that enables a person to effectively cope with the normal stressors of life, realize their abilities, learn well, and work well. And psychological health can be interchangeable with the term mental health. A psychologically healthy and safe workplace is a workplace that promotes employees' psychological well-being and actively works to prevent harm to worker psychological health. And the last concept is a psychological health and safety management system. And this is a systematic approach to develop and sustain a psychologically healthy and safe workplace through the prevention of harm, the promotion of health, and the resolution of incidents or concerns. As far as data collection and review goes, what we really focused on was the National Standard of Canada for Psychological Health and Safety in the Workplace. And why we're paying so much attention to this standard is that it is really considered the gold standard for psychological health and safety in the workplace. It was created in 2013 by the Mental Health Commission of Canada in collaboration with the Canadian Safety Association. It was the first of its kind at the time worldwide, and since then it's been adopted by countries around the world. And what makes this document really, really great is that it outlines the minimum requirements for a workplace psychological health and safety management system. And those requirements are broadly categorized into areas such as commitment, policy, leadership, assessment and control of psychological hazards, as well as how to monitor and evaluate a system. The other big component to this document is that it identifies 15 psychosocial factors that all workplaces can control to protect and promote psychological health and safety in the workplace. And so if you're not familiar with those psychosocial factors, I've listed a few of them here. So they are things like clear leadership and expectation, civility and respect, recognition and reward, growth and development, workload management, engagement, and involvement and influence. Now, all of these psychosocial factors are on a continuum, meaning that any one of these factors can either safeguard a worker's health or they can put a worker's psychological health at risk. The last piece I'll speak about in regards to this document is that it also comes with an internal audit tool where an organization can use that tool to assess where they are in terms of meeting the standards requirements. And so part of our data collection, review, and analysis was to do a gap analysis using that internal audit tool to identify how our current system is meeting the requirements. Additional data that we looked at were results from the 2023 Internal Mental Health Staff Follow-up Survey. The results really identified the psychosocial factors that staff are feeling that are protecting their mental health, and also those that have the potential to pose risk. It also revealed that perceptions of psychological health and safety vary between programs and services, and that unique needs are within the health unit, and that those needs are constantly changing. So what that really highlighted for our work group is that whatever activities that we roll out to bring this strategy to life, they're going to have to be adaptable to programs and services and their needs, and also adaptable to changing times. We also consulted the Strategic Plan Discovery Report, which further identified psychosocial factors that are protective and those that are presenting risk. And we did environmental scans of our policies and procedures to see how they were lining up with the national standard. And we also looked back at training evaluations from previous offerings that we've done in regards to psychological health and safety. And we collected some anecdotal feedback as well from staff. When we looked at all of the data, we identified strengths. So we have a robust occupational health and safety management program already in place. And this program already meets many of the requirements of the National Standard of Canada. So it will be a lot easier for us to weave in those psychological health and safety components, knowing that we already have the framework in place. We also have key procedures in place that support psychological health and safety, and those would include the critical incident debriefing procedure, the emergency color code response. They all have a component of psychological health and safety integrated into them now. The hazard analysis was updated to identify psychological hazards in addition to the traditional hazards. And the job demands profile procedure was also updated so that when doing job demands, we're assessing for the demands that are psychological in nature. Our data collection and research also, sorry, Danielle, can you go back one, please? Thanks. It also revealed that we have supportive environments in place. Most staff feel that the workplace is already full of support from peers, and in general, staff feel that the workplace is one where there is civility and respect. And as I mentioned earlier, we're also, another strength is also the Internal Mental Health Working Group, which has already been advancing psychological health and safety. So as far as opportunities go that were identified from our data collection, we've transferred those into outcomes. And at this point, we've solidified and agreed upon 2 outcomes, and we're in the process of developing a 3rd and a 4th. But I'll share with you the 2 that we've agreed upon and we've sort of sketched out. So one of those areas and outcomes would be staff education and awareness. So at the end of this strategy, the goal will be to have improved staff awareness of those 15 psychosocial factors and their role in promoting and protecting psychological health and safety in the workplace. We'll also have improved staff understanding of mental health and wellness, mental illness and resilience, and how those concepts interconnect. We'll also have increased staff awareness of mental health resources available to them. We'll have strengthened supervisor competencies in supporting psychological health and safety in the workplace. And that should translate to a reduction in stigma. And Danielle, perfect, thank you. We'll also be looking at strengthening our occupational health and safety management system. So our goals for this outcome will be to have integrated psychological health and safety into the existing occupational health and safety management system to meet all the requirements listed in the national standard. We'll also be integrating psychological health and safety components into our organizational policies and procedures. We'll have increased staff awareness of psychological hazards in the workplace, and we'll have increased staff engagement with the OH&S Occupational Health and Safety Management System. We'll also have improved HR awareness of psychological job demands and have increased the capacity of human resources and the Joint Health and Safety Committee to effectively respond to psychological hazards. So over the next few weeks, our main focus will be to, like I said, further hash out those last two outcomes, and also to then start thinking about activities that are going to bring these outcomes and this strategy to life.
Great, thank you, Shannon. And I hand it over to Tanya, who's also online for our next strategy spotlight.
Thanks, Danielle. Good evening, everyone. Can you hear me okay?
Yes.
Yes, okay. All right, so I am co-leading Priority 2 Strategy 3 to advance initiatives to address mental health, substance use prevention, and harm reduction. And I'm excited to share our progress with you and give you a sense of our direction. So over the last 6 months, we have focused on these two planning stages. In the assess stage, we have conducted a situational assessment, which involved looking at a variety of data sources, including the discovery report and population health data sources, such as the Canadian Community Health Survey and the Child and Youth Health Survey, as well as the Planet Youth Nipissing data, best practice documents, and the Ontario Public Health standards. We also conducted a SWOT analysis as a working group. So looking at strengths, weaknesses, opportunities, and threats under these three topic areas. And we have moved into the recommend stage, where we've identified priority populations and determined focus areas under these topic areas. Next. For the purpose of planning, we have grouped together mental health promotion and substance use prevention. So mental health and substance use share many risk and protective factors. So our Ontario Public Health Standards encourage us to plan for these topic areas together. So we've aimed to identify an upstream approach that will advance these two topic areas collectively. Harm reduction requires a distinct focus area because it is a distinct approach to substance use and is rather unique from mental health promotion and substance use prevention. Next. So in terms of our mental health promotion and substance use prevention situational assessment, I'll share with you both some needs and strengths that we identified. So in terms of population health burden, it will not come as a surprise to you that our health unit region is experiencing, mental health and substance use as pressing concerns. And this is shown not only through population health data, but also through the voices of our interest holder groups. So we've seen that come up through the discovery report, but also if we look at some key statistics, we can see that our health unit region has, for example, higher rates when compared to Ontario of mental health related emergency department visits, higher rates of diagnosed mood and anxiety disorders, and significantly higher rates of suicide and self-harm, with youth disproportionately affected in terms of emergency departments for self-harm. And we know that these issues of mental illness or poor mental health and substance use are deeply intertwined with the social determinants of health. So issues like poverty, housing instability, food insecurity, racism, adverse childhood experiences, And our interest holder groups through the discovery report have called on the health unit for strengthened leadership around upstream action on the social determinants of health. They've also called for early intervention, so reaching children and youth before issues escalate, and reducing social isolation among youth. Our SWOT analysis showed us that we could benefit from a strengthened cross-sectoral response to improve child, youth, and family well-being. We recognize that childhood and adolescence are critical periods of development, and that's where essentially we can get the most bang for our buck in terms of yielding positive results. We have also identified that we would like to have some focused efforts on those evidence-based interventions that are working really well and that our region is excited about, such as Planet Youth Nipissing. And we are well positioned to take on this work. So we have very strong partnerships at both the local and provincial levels, especially within the child and youth sector. We have priority public health interventions centered on child and youth well-being that can stand to be better aligned and built upon. And there is great provincial momentum and a lot of excitement about the Ontario Early Adversity and Resilience Framework, which has recently been launched. Thank you. So when we start to narrow in on a focus area, all evidence points us in the direction of strengthening child, youth, and family well-being. Our goal is to improve child and youth well-being by promoting and supporting the implementation of the Ontario Early Adversity and Resilience Framework as an upstream equity focused approach that allows us to align and identify priority evidence-informed interventions, and to do this across sectors through cross-sectoral collaboration, and to address the social determinants of health collectively. I encourage you, if you're interested, to seek out the Ontario Early Adversity and Resilience Framework, which you can find on the Simcoe Muskoka District Health Unit website. Next. In terms of harm reduction, I'll provide just a bit of background about what harm reduction is all about before getting into our situational assessment findings. So harm reduction is recognized as one approach to addressing substance use. It aims to prevent or lessen the negative health, social, economic impacts associated with substance use. So providing safer substance use supplies and education intends to prevent the transmission of HIV, hepatitis C, hepatitis B, and other infections and injuries related to sharing or reusing substance use equipment. The priority population for harm reduction services are people who use substances. And we know through servicing this clientele that they often have complex health and social needs. And for many, harm reduction services may be their only connection to formalized support. So through our situational assessment, we looked at both needs and strengths. So I'll go over those with you now. Thank you. In terms of population health burden around this area, in recent years, we've seen both a steep rise in opioid-related toxicities, as shown by local data, and a growing demand for harm reduction services. There have also been 2 HIV outbreaks since 2019, both involving substance use and equipment sharing as transmission risks. In terms of service demand, it's quite impressive, but also unfortunate. So we have our needle syringe program visits at the health unit have increased 2.5 times since 2019. Our naloxone distribution to health unit clients nearly doubled in 2023. So our staff are responding to this increasing need. Our interest holder groups call for improved communication about health unit services that goes across services and service enhancements to harm reduction without getting overly specific in the discovery report. They also call for rural access to health unit services, so this would apply to harm reduction as well. There was a needs assessment which showed the need to reduce barriers around things like transportation and after-hours access to harm reduction services, which we've seen some response to by the health unit. And our SWOT analysis showed that we could benefit from a strategic framework to define our priorities and inform and guide our actions. And next, in terms of strengths, we have a wide range of harm reduction tools and strategies that we're offering. So we are offering safer substance use supplies and education. We have innovative access initiatives such as our Health Box. We have also established and helped maintain satellite sites for naloxone and needle syringe program efforts. The health unit hosts essential community of practices where community partners can get together to collaborate, where also individuals with lived experience are represented. There's been a stronger attention to integrating the voices of people with lived experience into our planning and program delivery. We have also integrated health promotion and harm reduction services, and we see that we have a supportive environment. So people are accessing our services where they are coming away with that sense of empowerment, and we have that opportunity to connect them to other services, which may include treatment services. Next. So our focus area for harm reduction is to develop a harm reduction strategic framework. So this would essentially be an organized representation of our harm reduction work, which would help identify priorities and responsibilities that are within the scope of public health. It would strengthen our organizational understanding of the health unit's role in harm reduction, ensure that we're using existing resources as efficiently and effectively as possible, help us develop and leverage community collaborations and assets, ensure that our harm reduction services are sustainable and equitable, and ultimately advance health equity among people who use substances within the broader context of equity work within public health. So these are our two focus areas under this strategy. Our working group is very much looking forward to further planning in terms of the details of how this will roll out. And we thank you for the opportunity to share that update with you.
Great, thank you, Tanya. So that concludes our presentation today. Hopefully that gives you a good idea of what we've been up to over the last year, and gives you a couple of some progress in terms of 2 of the 11 strategies that are working towards our implementing our strategic plan. We're happy to take any questions.
Just first of all, just thank you. This is a great presentation. Thank you. Great work, and it's pretty enlightening. And just one question for myself. Does a copy of this go to other municipalities?
It's strat plan.
As far as information that what we do exactly?
We share our strat plan publicly, but as far as updates, what we're doing, like through Board of Health updates, those we shared, but we don't have like a regular reporting mechanism we use necessarily externally all the time.
There's also the annual report. We just released actually Monday of last week. So that's another way. And that was sent to all municipalities as well.
Okay, good.
And the way we communicate with the municipalities.
Because you get that question a lot from the outside asking questions because of homelessness and everything that's happening in our district. What exactly are we doing? And you don't always have the answer. So how do we get that out to the public? How do we get that out to the municipalities so they can let their people know? To kind of follow the GIF, what I'm trying to get across. Yes, Jamie.
I fully support that because I know that I think Ashley's been sending the minutes out, that sort of thing, to the different municipalities. But the more they see, the more they're aware. So 100% on that.
Yeah, because if we make a point of what we're sending out as far as what we're, the strategy we're doing, I think it'll get more impact. Because what happens, you get a package, company, health unit, conservation authority, whatever, most councils just kind of read through it. And not being sophisticated, but that's what happens a lot of the times. But I'm going to bring it forward myself at our own municipality the next time, but I mean, just how we promote it, how do we get to the other stage, to the other step, and what we can do to help.
I mean, and it depends on the municipalities. Certain municipalities were invited to participate in the community safety well-being planning, and it's a mechanism reporting on progress there. That's a mechanism through which we can highlight work that's done, not just within the health unit, but collaboratively with other partners. So that's a potential as well.
No, I agree. Like most of the stuff goes to DSAP, right? Every thing's DSAP because that's where all the money goes. But how do we help promote public health? How do we help them promote this to the next stage? Is what I'm getting at. So, I hope we can do something, and I really appreciate it.
Yeah, so there may be elements of this that could be shared, especially the more externally focused. Especially as like just the Board of Health meeting, which is a public meeting.
A lot of this connects to our core work that we're doing. So it's mentioned a lot of times in the medical officer health update as well to the Board of Health. So there'll be different areas that touch on what we're doing in all the areas strapped by that as well.
Okay, I'll open up to questions. Anybody else has any questions? See no more. Well, thank you again very, very much. This is a great presentation, and
Very good.
it's a really eye opener. Thank you so much.